Good morning, everyone. I'm Bob Ravenscroft, the Vice President for Advancement. It is the 12th of January, 12th, right? Yes. 12th of January, 2021. We had at midnight 514 patients here at Bryan. As you can see on the chart as it relates to COVID, it totals 77 patients at the time of pulling this report. It breaks down in the usual categories that the media will be sent in the press release of positive, resolved, and clinical. I would add that since that time of pulling the report, there are 16 other patients that have been hospitalized that are pending their test results. Clinically, it looks like, it certainly could be COVID. So what we kind of are thinking at this point is we have 93 of our beds consumed by COVID resources. As far as the level of care of these patients, not counting those 16 pending their results, is 12 of them are in the ICU and 9 of them on ventilators. As you can see on the following chart, the breakdown by county, Lancaster County is outpacing outstate Nebraska at this point in time. It's interesting. I was talking to Dr. Jarrett. He's one of our pulmonologists. As I was walking over here, we were together in the hallway, and to see the relief on his face, we are certainly preparing for a significant uptick based on the travel numbers you were seeing, and I would say there is a sense of relief that we haven't gotten there. So we certainly hope not, but time are going to tell. As you've been following this very closely, there's been an ever so slight uptick here at Bryan. What we're doing is really what we're doing, I've been doing since February, is preparing still for additional surges. That means securing all of the testing supplies, PPE, and staffing resources we need. I'd say what we would, really, really urge and recommend is it's imperative for the community to stay vigilant. Throughout this whole deal, we've heard about healthcare workers being the front line. Another way to look at it is we're the last line of defense. So you can really help us be the front line by continuing to mask distance, watch your gathering sizes, and hand hygiene. Cannot overstate that enough. Well, we do have a ways to go. I know everyone's following this closely, and the CDC has put out there that it'll take 75 to 80% of the population to finally kick this. So we do have a ways to go. Close. The Moderna vaccines, second doses will begin on January 22nd. It'll take several days to complete the employees that have received that. As far as when will we be done vaccinating, probably not for a really long period of time. Now we're kind of moving to a phase of what do you do with new hires and people who come into the organization. And obviously the supply chains need to release a little bit so we can almost constantly have a very, very small amount on hand to vaccinate new hires. So it's wonderful news that it sounds like more is going to be released for the public here very soon. I would say, in comparison to the mid-peak, it is certainly better. You could hear it, frankly, in our voices when things were, in November, really getting out of control here in Nebraska. And we were at that time on the verge of replicating some of the very tragic scenes you're seeing in other parts of the country. I don't remember. I think we had 160 plus patients in here at our highest time. So as far as morale, I would say we've kind of had two primary audiences since we began this, early last year, and it has been with the public and the media is one to, our pledge to be as transparent and open as possible. The other audience, and that really picked up speed in the fall, has been our team. We have constantly watched this, and what we are doing, frankly, is communicating on a weekly basis. Every Monday and Wednesday, kind of minutes or notes from our pandemic call is sent out to our team to keep them informed. We have encouraged them to watch these press briefings because they get the information as soon as you're getting it and as soon as we have it in some cases. So, we make it available on our intranet, our employee internal intranet. We urge them to watch via Facebook Live or our Bryan YouTube channel and so forth. And then on Fridays, we open up a Zoom call with the CEO of our health system where he kind of reviews the week of COVID, what's ahead, and answers any questions from employees. So that's kind of what we're doing from a communication standpoint. Another thing that we do here at Bryan is what we call rounding. And members of the senior team and our directors fan out weekly throughout the organization. And prior to COVID, much of our rounding was certainly focused on the staff, but we would go in and visit with patients. But with visitor restrictions, obviously, we couldn't do that. So we recalibrated how we approach rounding, and it is to constantly be up there talking to our staff. Typical things we ask them is what's working well, what's not working well, and your ideas to fix it. Is there anyone to think, just get a general sense of how things are going up there. And we've continued that. Senior team members, directors, we continued around even on COVID floors and so forth to keep a pulse on the staff. We have offered EAP programs, employee assistant programs, for employees that might want counseling. I can tell you we've begun discussions on trying to get a pulse on what will be the long-term effects of this on staff. Fair to say everyone's story is different, but I'd say the staff is doing well. They really are. To me personally, it's been a very rewarding year in a sense that these are some of the strongest, toughest, most compassionate people you'll ever meet, and they tell us they're doing fine. I think another thing that has helped is we've been able to rotate some of our ICU staff off of COVID floors as numbers has decreased to give them a break so they can go see, your normal ICU patients that aren't COVID patients. I think they saw us fight for every available piece of PPE and so forth. So in general, I think they're doing well. I'd say there's two other pieces that speaks to morale, though, and one that we can never, overestimate the impact of it was the outpouring of community support was a tremendous uplift to the team throughout this, and it remains important. And then the other one has been the vaccination or the vaccines arriving and the stellar response that we've had to colleagues getting vaccinations so far. So you put all of those things together, it's going well, but I'd say it's something we're constantly vigilant of and continuing to watch. A couple of things. I mean, the state health departments have been very good at communicating with the hospital. So I don't know, it was probably last week sometime, maybe a little longer, where they didn't ask for patient names, but they wanted to know our patients kind of in our network that were 75 years and older so they could begin getting the counts on what was needed in the state. And they have requested that for, now at the age break off of 65 and older. So I would expect the stuff that I checked right before I came in here, the current administration is kind of emulating the future administration's pledge to release more and more vaccines. So I would imagine you're going to see more and more vaccines released, and everyone's working together on what kind of the vaccination plans will be. John Woodridge sits in on all of those calls, so he's really connected with it. And as we've said in the past, we are here and ready and willing to participate in whatever way we can to help get the community vaccinated once that is released, Matt. So hopefully that helps a little bit. It is indeed true that they have asked for counts on our patients. And obviously that's not hospital patients, it's people in our network that are 65 and older. And then the health department has their information. Other St. E's and Lincoln Surgical Center would be supplying information. So I think that is all geared towards how many do we need here for this next wave of public vaccination.